big difference in giving something chronically short term. Okay. There's a question here. Why isn't MRS testing results used more frequently? Promising seems to be promising and very specific. Mark may be able to comment on some of the two. We're doing MRS as magnetic resonance spectrometry. So most people are familiar with what an MRI is, to do a picture of the brain. MRS is a variant of the MRI that gives you a picture of some of the chemicals in the brain. Some of those chemicals, the amounts of those chemicals can be altered in different disease states. The majority of MRS is done on what we call a 1.5 Tesla MRI. That's the standard MRI. It gives you a qualitative look at these peaks that represent different chemicals. The stronger one that we're looking at are able to crunch through all these numbers. It's usually intensive. Hopefully, actually put a number to it to be more comparable against study for study. It's a research test. Results that look like they might be promising, but it might be useful in the future. We just haven't fully characterized it. We need to do a bunch more work to characterize it. There have been some studies published with it in small numbers. It's not clear that our data is actually reflecting what they saw. We're doing it in a fundamentally different way too. I mean, on a different instrument. So I think that's still an open question. There's a question: are there any differences at baseline on children on an organic natural diet and children on current U.S. preservative diets? Natural history trials get all kinds of different things because people are trying different things, trying different supplements. I would say we do not have enough data to separate out these groups. What I would say is my recommendation is a normal diet for age. It makes you feel better to do a preservative-free diet. It's not breaking your family bank. That's fine. But don't go to a diet that is skewed nutrient-wise. Remember, these are growing kids. They do need things like cholesterol. For example, don't go to a cholesterol-free diet. It's one out there because that cholesterol doesn't get to the brain. Normal diet for age, whether you want to go preservative or not, free or not, don't know. We wouldn't have enough data to say that would help or not help. And then you recommend chest physiotherapy daily, prophylactically. In any chronic disease, supportive care, so care that you're doing that helps patients, it's not a disease-specific, good nutrition, that kind of thing, and all the benefits. The CF community had huge benefits, things that weren't drugs directed specifically
those turned into a clinical session, which is fine. We just have more time to run one. But I just endorse what Danny said, and that is, and I think the phrase to remember is there is no untreatable disease. If someone tells you your child has an untreatable disease, tell them they're wrong. Because every disease is treatable. Hardly anything is curable in 2010. None of the common diseases in our society are curable, but they're all treatable, and the same applies to this disease. And that is tremendously important because you can make a huge difference to quality of life. Respiratory care is important. Care of the bowels is important. I'm sure, now of course, maybe that's the thing that's needless best at is curing constipation, but I'm sure many of you know what a nightmare it is dealing with constipation in children or adults for that matter who can't move normally. Everything is worse. Seizure frequency increases, their dystonia gets worse, spasticity gets worse. So that is tremendously important. It's not very sexy or exciting, but it's really important and it makes a huge difference to quality of life. The same applies to treating the other symptoms of the disease. We're going to talk more about that tomorrow. But I would certainly endorse that completely. When we published treatment guidelines, and we call them that because there's not a very big evidence base, and as Danny alluded to, no one will ever provide money to do controlled, double-blinded clinical trials of these interventions in this disease, let alone more common diseases. But there's a certain amount we know from clinical practice that does make sense, and so we can talk a little bit more about that tomorrow. But I just want to endorse the fact and say again, this is a treatable disease. There's a huge amount you can do to make a difference. And don't let anybody tell you any different. That's very, very important. If you don't remember anything else from this conference, remember that. Don't let anybody tell you that. We can't treat this disease. We can make a big difference to the quality of life of everybody who's affected by this disease, which means the children and their families as well. Okay, I'll get off my soapbox now. I just want to make one more comment about MR spectroscopy. It is part of clinical practice in child neurology. It is the best way to diagnose a disorder called creatine deficiency, which is 3 different genetic diseases. It's a very important screening tool for disorders of oxidative phosphorylation, which are often called mitochondrial diseases. As Denny points out, when he mentions Tesla is an interesting subject for a whole talk by himself. He was a crazy man who took on Edison and lost. But his name is commemorated as a way of measuring the strength of magnets or magnetic fields. So a standard magnet used for magnetic resonance imaging has a strength of 1 or 1.5 Tesla. More powerful magnets are coming into use now. So we have a research imaging centre at Mayo, a 7 Tesla magnet. We have 3 Tesla magnets we're using routinely in practice out of the 30 or 40 we have at the institution. So this is actually becoming part of clinical practice, but measuring it and standardising it is difficult. I'm not aware that there's anything that is absolutely specific for any one disease except for creatine deficiency, where the peak disappears. This is not a new idea. Canada published a report of MR spectroscopy in NBC in 1992. It didn't really pan out. The equipment has changed. It's improved since then. There were studies in the 90s from NIH looking at different types of multi-point MR spectroscopy. So it's a tool that may be helpful, but I don't think we've yet reached the stage. Maybe we get some data where we can use it as a biomarker, but it has potential, obviously, as the technology gets better, then the potential applications can improve. I should turn to the questions I have now. The first question I can't answer is how can I get Miglustat in Canada? Well, Joe Clark is sitting at the back of the room. Joe may be able to help, because I don't understand what's called the healthcare system in the US. That's misusing the term system, I think, the healthcare debacle would be better. They actually have a system in Canada, and I'm sure that Canadian colleagues, maybe they could address that tomorrow,